Officer. I appreciate that the Cabinet Secretary states that the legislation and the policy of self-ID does not change the protections afforded by the Equality Act in terms of single-sex provision. This is the aspect of the bill that my constituents ask about the most. I understand that many organisations and institutions are already operating based on self-ID and that it may well be working for them, but that doesn't take away the need for female spaces for others. If the policy of self-ID is made law, how will the Government ensure that single-sex spaces and services for the purposes of upholding dignity and privacy, for example hospital wards, therapy groups, refuges and accommodation, are available to women and girls who need them and aren't diminished?
Cabinet Secretary.
Can I thank Ruth Maguire for her questions? So, I know that the issues that she has raised about the potential impact of the changes on single-sex spaces and single-sex services have been quite a focus, and I want to provide further reassurance on this, which I've done so far in my statement, which is why I've made clear today and in my engagement with people that the bill doesn't make any changes to the current position at all on the Equality Act protections. What it does is just simplify a process that has been in existence for 18 years and how a gender recognition certificate is obtained. I think it's also important to say that trans people don't need to have a legal gender recognition or a certificate in order to access facilities that align with their gender. These are protections that trans people and everyone else have under the Equality Act 2010, and nothing in what we are proposing will change the Equality Act or current practices. What the member outlines could be said of the current process, which trans people have been using for years, with no evidence of widespread harm, facilities like toilets and changing rooms, and although we may refer to them as single-sex spaces, are actually not legally defined as such under the Equality Act, and of course GRCs are not necessary to access them. But on the wider point around healthcare provision and single-sex services, which could include refugees, therapy groups, the Equality Act provisions will be unchanged. The Act sets out the protected characteristics and provides for exceptions. As I mentioned earlier on to Claire Baker, there is a general occupation requirement exception which can be applied when appropriate in relation to health services, for example, where intimate health and personal care services are provided. Our public services have been managing these issues for many years. I think, as I understand, the HRC is going to be revising guidance, which will perhaps help public bodies in terms of the practicalities of how they manage these issues. But the reality is that they have been managing these issues for many years. But I'm happy to keep discussing with Ruth Maguire and others about the detail of these matters as we take the bill forward.